Here's the ramus of the mandible. Here's the body, formed by the alveolar process and the base. Here's the angle, the condyle, the neck, the coronoid process, and the mandibular notch. Here are the symphysis, the mental protuberance, the buttress, the mandibular foramen, the lingula, the mylohyoid line, the submandibular fossa, and the mental spine. Here's the temporomandibular joint, the articular disc, the stylomandibular ligament, and the sphenomandibular ligament. Here are the lateral pterygoid muscle, the medial pterygoid muscle, the temporalis, and the masseter. On the hyoid bone, here's the body, the greater horn, and the lesser horn. Here are the mylohyoid muscles, the geniohyoid, the stylohyoid, the digastric, the omohyoid, sternohyoid, and the thyrohyoid. Here's the genioglossus muscle, and here's the hyoglossus. Now we'll move on to take an overall look at the oral cavity and at some important closely related structures. We'll look first at the shape and extent of the oral cavity. Then we'll look at the muscles of the cheek and lips, then at the teeth, then at the salivary glands. To understand the shape of the oral cavity and its extent, we'll look at it in a living model. Here's the tongue, here's the palate, here's the inner aspect of the alveolar process of the maxilla and of the mandible. The alveolar processes of the maxilla and mandible, together with the upper and lower teeth, project into the oral cavity from above and below. They divide the oral cavity into an inner part and an outer part. The upper and lower gums, or gingivae, are formed by mucous membrane that covers the alveolar processes on the outside and on the inside. The outer part of the oral cavity, the vestibule, lies between the teeth and gums on the inside and the cheek and lips on the outside. The mucous membrane of the lips and cheek is continuous above and below with the mucous membrane of the gums. The inner part of the cavity is closed off above by the hard palate and further back by the soft palate, which ends back here at the uvula. It's closed off below largely by the tongue and also by the mucous membrane of the floor of the mouth. To see the features of the posterior part of the oral cavity, we'll look at a dissected specimen that's been divided in the midline. This specimen is missing a number of teeth. The mucous membrane that lines the cheek passes medially behind the last molar teeth and becomes continuous with the mucous membrane of the inner part of the oral cavity. The front of the ramus of the mandible is here. To look at the wall of the oral cavity further back, we'll move the soft palate backward. This fold in the mucous membrane, running from the soft palate to the side of the tongue, is the palatoglossal arch. It acts as a dam, preventing liquid from spilling backward past the side of the tongue. This less noticeable fold is the palatopharyngeal arch. This triangle between the two arches is occupied in early life by a prominent mass of lymphoid tissue, the tonsil. In later life, as in this specimen, the tonsil atrophies. Here's the palatoglossal arch in a young person. Here behind it is the tonsil. We'll look at the soft palate along with the pharynx at the end of this section. Now that we've looked at the overall shape of the oral cavity, we'll move on to look at the muscles of the cheek and lips. The muscles we'll look at are the buccinator, which forms the muscular lining of the cheek, and the complex of muscles that surround the mouth, collectively called the orbicularis oris. Before looking at these muscles, we need to get acquainted with a ligamentous structure that the posterior fibers of the buccinator are attached to, the pterygomandibular band, also called the pterygomandibular raphe. The pterygomandibular band, represented by this piece of material, passes from the pterygoid hamulus to the posterior end of the mylohyoid line. Two muscles arise from it, the buccinator in front and the superior constrictor of the pharynx behind. The pterygomandibular band can stretch to accommodate jaw movement. Now, to see the muscles of the cheek and lips, we'll look at a dissection in which the skin and subcutaneous fat have been removed from the lower part of the face. The muscles of facial expression have also been removed. Here's the orbicularis oris. Here's the buccinator. The two are closely associated. We'll look at the buccinator first. Here it's partly hidden by the masseter muscle, which we'll remove. The buccinator is a thin pouch of muscle that closely follows the contours of the mucous membrane of the vestibule. It has a long line of origin. The buccinator arises from the maxilla and from the mandible along these lines. Above, the line of attachment curls round behind the tuber of the maxilla. Below, it curls round onto the buttress of the mandible. Between these 2 points, the most posterior fibers of the buccinator arise from the pterygomandibular band. The buccinator muscle passes forward and divides at the corner of the mouth. Its fibers continue forwards to become the deepest part of the orbicularis oris. The orbicularis oris muscle complex surrounds the opening of the mouth. It consists partly of intrinsic fibers, but it's formed mainly by the fibers of other muscles, on the deep aspect by the continuing fibers of the buccinator, and on a more superficial level by these muscles of facial expression. We'll take a good look at them in the last section of this tape. The action of the orbicularis muscle is to press the lips together, closing the mouth. The action of the buccinator is to prevent the cheek from distending when we raise our intraoral pressure. When we let the buccinators relax, this happens. Now that we've looked at the muscles of the cheek and lips, we'll move on to look at the teeth. These are the lower teeth of a young adult. In the full dentition, there are 16 teeth above and 16 below, 32 in all. In each quadrant, there are 2 incisors, 1 canine, 2 premolars, and 3 molars. This individual's 3rd molars have been removed. The incisor teeth are flat and chisel-shaped. The canine teeth have a crown that's cone-shaped and a massive root which forms a prominence in the gum. The premolar teeth are broad and short from front to back. They have 2 projecting cusps. The molars are longer from front to back than the premolars and have from 3 to 5 cusps. Each tooth consists of a crown, which projects above the gingiva, and a root or roots which are embedded in bone. The tip of the root is called the apex. The crown and the root meet at this slight narrowing, the neck. The crown is covered on the outside with enamel, which is extremely hard. The inner part of the crown and the root are made of dentin. The tooth is fixed to the surrounding bone by a layer of specialized periosteum, the periodontal membrane or ligament. The space within the tooth is the pulp cavity. The pulp of the tooth contains blood vessels and nerves, which enter through the apical canal. The incisors and canines have 1 root. The premolars have a single root that's forked at the end. The molar teeth have multiple roots. The upper ones have 3. The lower ones usually have 2. Now that we've looked at the teeth, we'll move on to look at the glands that produce saliva, the salivary glands. There are 3 salivary glands: the parotid gland on the side of the face, the submandibular gland beneath the body of the mandible, and the sublingual gland in the floor of the mouth. We'll look at the parotid gland first. Part of the parotid gland lies superficially in the posterior part of the cheek.